Hello, my name is Patricia Miller. I'm a registered psychologist and a registered clinical social worker with a PhD in behavioral social sciences and currently working on my PsyD, kind of in my last segment. And this research I'm presenting today is my research project. It's called The Role of Self-Determination in the Healing of Trauma. Really looking at the diversity of traumatic experiences that people may go through and how many of these individuals and communities will get neglected versus helped. So when I talk about traumatic experiences in my research, I'm looking at some diversity around the different types of trauma or traumatic experiences that people will experience, and then looking at the role of self-determination in their healing as they self-determine what healing works for them, whether with a professional or without, or different processes, how they found them, what's made meaning for them. Briefly on the background research for this study, a lot of background knowledge was built in relation to, prevalence of traumatic experiences, looking at who's impacted, how they're impacted. And remember, traumatic experience, when someone goes through it, it turns into the lived experience of trauma. And so this research is about that lived experience of trauma and healing and the role of self-determination. So one of my kind of primary questions around this research is, I don't want to understand more about prevalence of traumatic experiences, and one of the things I've been thinking about is really understanding in the healing of trauma, what is the role of self-determination, looking at postmodern feminist theory that talks about our right to have value in our relationships, equity in our relationships, but also the role of self-determination as we're living in this world. And so I took that into this idea of, as people are healing around their trauma, within their trauma from traumatic experiences, what role does self-determination play versus other determined healing, which is where we come in sometimes as professionals with that really good intention, evidence-based practice, but it may not be the right time or the right healing experience for our clients. And so I'm really trying to get a deeper understanding of the phenomena of trauma and the healing that people go into and go through, and then the role of self-determination as they're seeking to do their own healing or to do their healing with professional help or with any other process which might be more cultural or something that's more meaningful that they've found through other people and or experiences, or they've started to create it themselves. So the methodology of this research, of course, becomes very important, because whenever you're going to do research around the risk factors associated with people that have already gone through traumatic experiences, psychological safety, having a really rigorous methodology, something that we can make sure protects people and that people have choice all the way through to participate or stop participation, becomes really important. So this is a non-experiential qualitative research project, up to 20 to 25 participants, aged 25 to 40, who have come through different backgrounds in relation to experiencing some sort of traumatic experience. We do have some limitations on that. They are addressed in my research on who we would not try to have be a part of our research, just based on severity of impact around certain traumatic experiences. There's going to be a semi-structured interview format, interpretive phenomenological approach. Sorry, that's a long word to say, but it is looking at the phenomena of trauma and doing it through depth analysis, interpretive, right? People's lived experience and what that means as they've chosen to heal their trauma. Lastly, looking at possible understandings. This is where we stand with people in the research. Really, the postmodern feminist theory lens asks you to ask yourself who's included, who's not, why are they not. And so we do have some limitations on around who will come in based on not wanting to re-traumatize people that have had severe traumatic experiences, but looking to find voices and diverse lived experiences to enhance our understanding.